Many of us often complain of pamamanhid, pangangalay, or tusok-tusok. In fact, a recent study shows that 99% of Filipinos in Metro Manila alone experience these symptoms at some point. Now, this could be a sign of nerve damage or neuropathy. It's when the nerves located outside your brain and spinal cord are damaged. But don't be too alarmed. Early detection and preventive measures can help protect against it. On the program today, we'll talk more about neuropathy, what causes it, and the most effective ways to prevent as well as manage it. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Nerve damage or neuropathy is increasingly common here in the Philippines. Now, our guests are here today to tell us more about this. With us is Dr. Epifania Collantes. She is a neurologist from the UPPGH and Manila Doctors Hospital. Now, to better understand what happens when someone has nerve damage, it helps to know just how important the nervous system is for us in order for us to function. It guides us in almost everything we do, think, say, or even feel. Now, Dr. Epi, can you further explain to us its role sa katawan natin?
So important yung nerve, it's our communication to the environment. Like if there's heat, it is perceived by the nerve. The information travels to our brain, and then the brain sends signal to the spinal cord down to the nerve. Like if we touch heat, so it can perceive hot temperature, goes to the brain, and then we withdraw our extremity. So yung nerve kasi merong three components: motor, sensory, tsaka autonomic. Pag motor lang yung problema, nanghihina yung katawan natin, yung mga extremities. Pag sensory sensation yung problema, manhid, tusok-tusok. Pag autonomic, ito yung sa paghinga natin, sa pag respiration, yung beating ng heart, yung gastrointestinal, yun ang autonomic nervous system.
Yan, sinabi na ni Dr. Epi, yung nervous system natin, it actually can divide it into more than one part. So you have your central nervous system, which is made up of your brain and spinal cord, and the peripheral nervous system. Dr. Epi, tell us more about this.
Yung central nervous system, importante yun. Yung brain and spinal cord, importante sa paggalaw natin, pag-iisip natin, pag-communicate. Yung spinal cord, paggalaw, sensation din. Yung peripheral nerves, tamang sinabi mo, yun yung sa extremities. Buong katawan natin nakabalot ng nerves para sa perception natin.
Now, when there's damage or disruption to your peripheral nerves, you may have some form of neuropathy. Now, we mentioned that many Filipinos experience pamamanhid or numbness on their hands and as well as their feet, pangangalay or yung nanghihina yung mga muscles nila, at ang tusok-tusok or that tingling sensation, lalo na sa mga daliri nila. Now, these are some general signs of some level of neuropathy. Pero Dr. Epi, briefly walk us through which part of the body is most affected kapag meron silang nararamdaman na ganito.
So yung spinal cord natin, lumalabas yung mga nerves. Yung nerves na yun pupunta sa muscle, So kung yung nerve natin, kung pangit yung conduction, so nasisira yon. So afferent kasi yun ang nakaka-feel. Pag hawak natin ng temperature, manhid siya, lalo na severe brain nerve damage, hindi natin ma-feel yung hot temperature, nasusugat tayo. So isa yon. Pero pag worse na yon, kung sa simula, tusok-tusok lang, ngalay, manhid, kasi damage yung nerve. Later on, wala nang pakiramdam kasi severe yun na yung damage. And later on, yung muscle lumiliit na, kaya humihina din yung paggalaw natin.
Doc Epi, let's discuss what happens kapag ang autonomic nerves natin ay may problema. What are some of the signs, symptoms na kapag may problema dito?
Yung autonomic nervous system, di ba, involuntary yon. Yung pag-beat ng heart, 24/7 dapat naka-switch on yung paghinga natin, yung GI, yung pag kumain tayo ng pagkain, bumababa lang sa gastrointestinal. Pag nagka-problema, important dito, like ang paghinga, hindi na masyadong nag-e-expand yung lungs, so hirap huminga, So, or kaya bigla na lang humihinto yung puso kasi yung nerve papunta doon damage or bumabagal yung puso, bigla na lang humihinto o kaya nag-hyperactive, irregular yung heartbeat, And then kung minsan erectile dysfunction sa mga lalaki, ano, kasama din yun, no? So yung iba rin abnormal yung sweating. So kasama yun sa autonomic.
So yung mga simptomas ng autonomic nerve damage almost always affects your bodily functions na wala kayong masyadong control dito, wala kayong voluntary control like your blood pressure. Now on the other hand, yung mga movements na or actions na meron kayong control at ito'y apektado, ito ay controlled ng mga motor nerves nyo kapag may problema dito. Ngayon, Dr. Epi, kapag ang motor nerves natin ang may problema, anong pag-usapan nyo naman ito?
So sabi ko nga yung nerve, motor, tsaka sensory. No? Pag motor lang, may pakiramdam, kaya lang mahina. Minsan bagsak yung kamay, may hinahawakan kang baso na nahuhulog yung baso. O kaya hindi makasuot ng tsinelas kasi natatapon yung tsinelas. O kaya pag naghagdan ka, hindi mo mataas, no? Kasi affected. Hindi lang yung nerve, pati yung muscle.
Ngayon, pag-usapan natin kung paano nakaka-apekto ang neuropathy sa quality of life ng isang tao. Dr. Epi, please go through with us what are some of the more common causes ng neuropathy.
Yung sanhi ng neuropathy, una, no, pinaka number 1 yung diabetes, no. Kung hindi kontrolado yung sugar, nasisira yung nerve, no. May mga shooting pains all over the body. Kung may problema sa kidney o liver, pwede rin yon. May mga gamot din na magpo-cause nito. Halimbawa, nagki-chemotherapy or may antibiotic or may anti-TB na gamot, nasisira din yung nerves. May mga toxic substances, pesticide, pag nagsispray, no? Or kaya nagpipintura lagi, exposed to lead, pwede rin ito. May mga infection din na magpo-cause nito. Kahit yung COVID, no? Malalaman sa lahat ng COVID, napapansin, tingling sensation, mahina, no? Or chronic fatigue, pwede yung nerve affected dito. Yung mga HIV, leprosy, no? Yung mga viral infection, minsan na yung nerve dito, may mga shooting pain, yung trigeminal neuralgia kasi na-damage yung nerve. Pwede rin trauma, pag naipit siya, nagbuhat ka, may snap sa likod mo, naipit yung lumbar nerves. Pwedeng severe pain ito.
One thing that the Doc Epi that you mentioned is that of dahil sa may diabetes. Pag-usapan natin yon because napaka-prevalent ng diabetes among Filipinos. How does this lead to some form of neuropathy? What are the conditions para magkaroon ng neuropathy ang isang taong may diabetes?
Sa diabetes kasi, yung nerve kasi natin may blood flow yon, no? So kung halimbawa nababara yung mga blood flow, pangit yung blood flow papunta sa nerve, naapektuhan yung nerve, nasisira yung nerve, no? Usually, distal muna na nararamdaman. Ito yung sa hands and feet, yun na munang namamanhid. Paakyat ng paakyat siya, kung lalo na pag hindi kontrolado yung sugar. Ngunit kahit kontrolado yung sugar, maaari pa rin makaramdam nitong neuropathy, yung diabetic, lalo lang kung matagal, more than 10 years na yung diabetes, matagal na. Mayroong mga changes na sa nerve kahit controlled yung sugar.
Vitamin B deficiency is also a main cause of nerve damage and many Filipinos fall short of the recommended amount each day. Dr. Epi, tell us more about this naman.
Yung mga alcoholic, no? So yung ang daming iniinom na alak, nagkakaroon ng vitamin B deficiency, no? Kaya makikita nila na manhid yung kamay yung mga alcoholic o kaya may mga gamot nagpo-cause ng pagbaba ng vitamin B, naka-metformin, no? Common sa mga diabetes. So, kailangan ng supplementation ng vitamin B.
Now, there are also some factors that can make you develop neuropathy. More on this when we return. We're your partner in healthcare. Keep it here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Our nerves are essential in everything that we do, from thinking, speaking, as well as how we feel. Now, when they're not functioning as they should, they could indicate nerve damage or some form of neuropathy. Now, anyone can be at risk of it, but there are factors that can make someone more vulnerable. Dr. Epi, tell us who are at risk of this condition.
Number 1, kung may mga medical conditions, especially in diabetes, liver, renal, no? Diseases, may thyroid problem, may cancer, no? Prone sila mag-neuropathy, lupus, yung mga ganon ng mga sakit, no? So pwede silang mag-develop nito. Work-related pwede rin, no? Yung nagbubuhat, naiipit yung mga nerves, no? Or nagkakaroon ng low back pains, or naglalaban, naiipit to, nagkukos ng carpal tunnel syndrome, nagsusulat, nagtatype, naiipit lagi, no? So work-related. Lifestyle din, no? Kung umiinom lagi ng alak, no? Or nagsisigarilyo, nadadamage ka agad yung nerves natin, no? Or meron din inherited, bata pa lang merong problema na sa nerve kasi genetic yung cause.
Now, we talked about how diabetes and vitamin B deficiency can lead to neuropathy. Now, repetitive motion, as mentioned also, can also leave you at risk of developing it. Dr. Epi, you mentioned how carpal tunnel syndrome can do that. Sino yung mga more at risk sa mga ganitong klaseng neuropathy?
Yung masisipag, no? If you keep on bending this, like if you cook, you wash clothes, no? Or nagtatype kayo, laging gano'n, no? Or lalo na texting also, no? Kung lagi kang nagte-text, nabebend kasi ito. It can cause numbness, magkakaroon ka carpal tunnel syndrome.
Now, if left unmanaged, neuropathy can lead to a number of complications. Dr. Epi, pag-usapan natin yung mga complications na ganito. Kapag, let's say, yung mga repetitive motions ay hindi naagapan, how bad can it get?
So masisira ng tuluyan yung nerve, no? Hihina yung grip mo, no? Pag sulat mo, you're dropping things, yung baso nagdo-drop, hihina ito, tsaka liliit yung muscle, mag-a-atrophy yung muscle. So importanteng mapakonsulta ka agad para maagapan ito. Or yung iba rin ng diabetic, di ba, nag-LBM kasi autonomic nervous system affected, no? Or constipated, or may erectile dysfunction, form din ito ng neuropathy.
Now, if you're experiencing any of these nerve damage symptoms, like a pricking, tingling, or numbing sensation in your joints and limbs, please seek your doctor right away. Now, you can expect your doctor to first take down your patient history and conduct a physical exam before taking some tests. Dr. Epi, walk us through how neuropathy is properly diagnosed.
Neurologic or physical examination, no? So, titingnan kung anumang symptoms mo, no? Compatible with neuropathy. You mentioned pricking pain, coldness, no? Numbing, numbness, no, or manhid, no. So yun ang symptoms. On physical examination, makikita ay wasted yung muscle, maninipis na, tsaka yung reflexes bagsak. So yung test na ginagawa, yung EMG and CV, no, electromyography, nerve conduction velocity. So nerve test ang gagawin.
What about a blood test? Meron bang makikita sa dugo kung merong neuropathy? Very familiar ang ating mga viewers with a blood test.
Makikita yung cause ng problema sa nerve, like mataas pala yung sugar, ay baka yung diabetes yung cause. May problema pala sa liver or thyroid, no? So, maimportante din yung blood test, like anemic pala, nagpo-cause din ng problema sa nerve, secondary pala. So
kahit papano, meron na tayong dagdag na kaalaman, especially what causes neuropathy and what we can do in order to manage that. So thank you very much, Dr. Epifania Collantes, for being with us today and sharing with us your expertise as well as your time and your insights. When it comes to neuropathy, prevention is a great cure. So we'll talk about the best ways to do this when we return. Your health is our mission here on MedTalk Health Talk. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Now, it's common to experience a numbness or a tingling sensation in your joints or even your limbs after walking too much, working in a desk, or carrying heavy objects. What we might think is just tiredness or being overworked can be a sign of some form of nerve damage or neuropathy. Now, this is why we need to take steps in order to keep our nerves healthy as early as now. So maraming mga events talaga sa day-to-day natin that can cause some form of nerve damage. Now, to talk more about treatment and prevention for neuropathy, with us is Dr. Alejandro Diaz. He's a neurologist and vice president of the Philippine Society of Clinical neurophysiology. Let's first talk about what we can do in order to help manage neuropathy.
First of all, just like any part of our body, we need to take care of the health of our nerves also, not only the brain, but also the nerves. Okay, so that includes good diet, regular exercise, good rest, and avoid bad habits such as smoking and too much drinking alcohol. Also, it's very important to have hydration also, not only having a good diet. It's also important that proper vitamin B complex supplementation, especially among those vulnerable of developing nerve damage, in order for them to have a good nerve repair, they should have a higher level of vitamin B12 in their body. And this cannot be obtained usually by diet alone, and one has to supplement themselves with higher vitamin B complex to assist in the nerve repair mechanism.
Pagdating dito sa nerve damage, meron bang set of people ang more at risk? Sino ba yung mga at risk of developing neuropathy or nerve damage, kumbaga?
So I see a lot of patients, non-diabetic, they don't have the usual disease, neuropathy, and they come to me complaining of numbness, manhid, like tusok-tusok, something like that. And when I do the EMG and CV, very mild neuropathy. And most of these actually are the elder people. As you can see, as one gets older, one's ability to absorb the vitamin B complex in the protein-rich food becomes impaired also. I think in one of the US study, about 15% of 60 years old and above in America already have some malabsorption problems. Also, those that are taking medicines, particularly those who are taking metformin or diabetic, can also have an impairment in the absorption of vitamin B12 particularly. Also, in some people who go into a specialized diet, then they lose the ability to take a well-balanced diet. So they're more vulnerable to develop neuropathy.
So having the right vitamins and minerals can actually help prevent nerve damage symptoms from reoccurring. Now, in particular, you mentioned vitamin B complex and vitamin E. Let's talk about that a little bit more, Dr. Diaz. What is the role of vitamin B complex in keeping our nerves healthy?
There are about 8 B vitamins, but the most important in the maintenance of nerve metabolism are the vitamin B1, that's the thiamine, vitamin B6, that's pyridoxine, and vitamin B12, that's cyanocobalamin. The vitamin B1 or thiamine is important to maintain a good impulse, the transmission of impulse in our nerves. It's also very important in the creation of the important neurotransmitter, acetylcholine, which is one of the predominant neurotransmitters from our brain that transmits impulses down to the nerves to the muscles. Next is vitamin B6. B6 is a pyridoxine. It's important in the creation of certain neurotransmitters such as serotonin, norepinephrine, and even the gamma-aminobutyric acid. These are very important in maintenance of our nerve transmission. Also, they are very important also in maintaining an efficient nerve transmission of the impulses in our nerves. And lastly, the vitamin B12. Vitamin B12 is important in the maintenance of the covering of the nerves.
Apart from vitamin B complex, Dr. Diaz, another vitamin that helps with nerve repair and can help prevent yung tinatawag na tusok-tusok is vitamin E. So tell us more about its role, doctor, and when is vitamin E supplementation recommended?
We think that the vitamin E is important in skin health. It's not only for skin health, but also for nerve health. Vitamin E is an important antioxidant. It maintains the membrane integrity of our cells, and that includes the nerve cells. So therefore, when you have a good vitamin E level, and many can develop vitamin E deficiency also, that's not only vitamin B12, then your integrity of the membrane and the balance of the oxidation and antioxidation can get imbalanced. So therefore, it's important to maintain not only B complex, as well as vitamin E levels in our body.
Together, vitamin B complex and vitamin E can keep your nerves healthy. Now, Dr. Diaz, before we go, do you have any other tips for preventing and treating neuropathy para magamit naman ng ating mga viewers?
I think it's very important to know ourselves, especially when one gets older. When you reach certain age, your ability to absorb B complex becomes lower. So it's important also to get the right dose. No? I think in one study, again, the recommended for 60 years and above to maintain is 1,000 micrograms of vitamin B12 to maintain a good myelin health. I think it's very important to maintain good levels of vitamin B complex and the right dose of vitamin E also to maintain a good nerve health and avoid nerve damage.
Thank you very much, Dr. Alejandro Diaz, for joining us today, sharing with us your expertise and giving us the nitty-gritty kung ano talaga ang benefits ng vitamin B complex and vitamin E para sa health ng ating mga nerves. So thank you very much for joining us today. I'm Dr. Freddy Gomez, and we'll see you again next time here on MedTalk Health Talk.